what we never ever bank on is that our kids would be put at risk. And I think that really hit home in that first week.
Yes, I did feel threatened, to be honest. What we saw on the news that's what freaked me out.
First 3 days were manic, and we were on the phones non-stop till 9 p.m. We just got slammed.
And people were losing their jobs, and we saw the news, the food banks, all those sorts of things. We just knew we had to do something.
When the country went into level 4 lockdown, we had to change what we had been doing in general practice for 20 years overnight.
We had a commitment to stay open for whānau. The only way to do that was to make sure that our staff didn't get sick, because if they got sick, then we couldn't keep our doors open. A lot of the other GP practices around here actually closed their doors.
Once I got home, I had a bucket outside for the clothes that I was wearing. I would just take all my clothes off there, just wrap up in a towel, leave my phone, the keys, my bag at the door, have a shower. My family were pretty good, so they knew to leave me alone until after I had a shower, after I put my things in the wash, clean my phone, wallet, bag.
I'd have to lock my doors. So that, and just sort of, toot to say to my husband, you need to come and get her. Like, she cannot touch me. That's what we had to deal with. That was, that was huge. And we've got a ton of mothers that had to deal with that. Can't contaminate my family. This is not, yes, our job is to support whānau, but not at the expense of your own, And I think that, that impacted on a lot of staff.
So women were still having babies, so we had to find a way of communicating with whānau in isolation. We also do wānanga for antenatal. At first I cancelled them, and then still got inquiries, how are we going to learn about having our baby? So I worked with the educators and we did Zooming.
We decided as a clinic that actually we're going to focus on people over the age of 60, calling up our kaumātua and just seeing, who they were staying with, did they have kai, could they access what they needed to, did they need medications, how were they feeling? And that included home visits for people where they couldn't get through.
To kaumātua, I delivered a food package to them, and they just couldn't get over the generosity within the food packages, and it was good for me to hear that.
If they were really sick, we'd leave them in the car, make a phone call, the doctor would talk to them over the phone first. Dependent if they needed a swab, the nurses would go out and swab them, making sure we had full PPE. If the doctor needed to see them, we'd bring them into the back room. Once the doctor finished talking with them, we'd have to clean out their whole space. Yeah, mopping floors, walls, beds, the curtains, everything after every patient. Yeah, all day. Doing the little kids, the babies, was the hardest. Get mum and dad to help hold them down, keep them still, so you could stick it up their nose far enough. Make your eye water for a couple of hours. And I think we ran out, had to do the throat one. Where your tonsils are, kind of had to get in the back behind them and make people gag. It was kind of something you won't forget, really. Yeah, the whole experience.
We've had a donation from Auckland City Council, 13 pallets of kai.
And we had great leadership from the Whānau Water Commissioning. All of the Whānau water providers, we've got about 76, I think, across the North Island, everybody pitched in and did what they could and got them out, and there's no other network like it really. One of the learnings from that was that actually Māori providers have a nimbleness and an agility to mobilise and to turn the ship around on a penny very, very quickly.
The notion of whakamā had to give way to I'm starving, I need some kai.
Yeah, we were pretty much worried about getting sick, so we really didn't want to leave the house. So in those times, them just delivering was, pretty blessing.
Yeah, a lot of food in here, tin, canned food, and all the stuff that we need to survive through.
Yeah, about 3 times. Yeah, and the 4-week process was pretty amazing.
So we've actually gone to the pensioner colleges and given flu injections to the pensioners as well.
I set a target of doing 200. We're nearing 1,000 now. A lot of the school-based health team then moved into providing what we called welfare checks. They were the deeper dive into whānau. And where possible, going and waving at people at the fence. Are you okay? Are your kids okay? Do you need anything?
We weren't set up for a virtual environment.
I went out and bought 72 laptops and 100 phones wherever I could access them, because we've got over 140 staff. It was a huge financial commitment.
In the first 2 weeks, we had done over 2,000 virtual consults. Just giving people a call. Are you okay? What's happening for you? Do you actually even understand what COVID is and what's it about? Right at the beginning, we came across a number of challenges. One, we were not provided with the PPE that we needed. It was critical. So we had to purchase our own, and that had a huge financial impact on us. That was money that had not been budgeted for. Our staff have got to feel safe.
And soon after the lockdown, we ran out of sanitizer. A 1 litre bottle of sanitizer was costing me $90. A packet of masks, over $400. We couldn't get PPE gear, so I bought a whole lot of painters' overalls.
Our funders are governed by a system which kind of delayed stuff. And so a lot of the Māori providers provided out of their own funds for whānau.
Turuki has had to bear the brunt of that financial impact. Wānanga online has been a really important part of what we do. Really responded well to having meditation and karakia and those sorts of things online.
When we were looking at 365,000, it just blew us away.
I think the need's going to be there for a lot longer to come.
Massive economic fallout from this, how that's going to impact health funding, how that's going to impact our whānau being able to access our services. The thing that's really hard to gauge is around domestic violence, abuse, those types of things, drug use. Like, they're the people that we don't see so easily.
Quite a struggle, because on the situation that I'm in, got a bracelet device on, and if these fellas help out, really good.
There has been a lot of late nights, but it's all been worth it when you see that smile on the kids' faces.
It's so lovely to receive an email from an 80-year-old man saying thank you very much. It's a good feeling to help others.
It'll be very hard without them, a struggle, and probably go downhill without their services.
Yeah, for the COVID, it's been amazing having support from Turuki Healthcare. After I met them, pretty much changed my life.
However long this takes, our mahi are going to tautoko, are going to support, are going to be there for our whānau through this period and whatever that looks like going forward.